Hello everyone. In this video, we will discuss about suicide and its prevention. In psychiatry, a suicidal attempt is considered to be one of the commonest psychiatric emergency. Every year, something like 3,000 people take their own life, and there are many more people who attempt suicide. Every suicide is a tragedy that affects families, communities, and entire countries and has long lasting effects on the people left behind. Suicide occurs throughout the lifespan and was the fourth leading cause of death among 15 to 29-year-old globally. Suicide does not just occur in high income countries, but it is a global phenomenon in all regions of the world. In fact, over 77% of global suicides occurred in low and middle income countries in the year of 2019. Suicide is a serious public health problem. However, suicides are preventable with timely, evidence based, and often low cost interventions. So, this video will be discussing about definition of suicide and types of suicide, risk factors, management of attempt suicide, and management of shock. One. So this is the definition of suicide. Suicide is a type of deliberate self-harm and is defined as an intentional human act of killing oneself. Suicide is a one of the psychiatric emergency. So psychiatric emergency is a condition wherein the patient has disturbances of thought, affect, and psychomotor activity leading to a threat to his existence, that is suicide, or threat to the people in the environment, that is homicide. Suicide needs immediate intervention to safeguard the life of the patient, bring down the anxiety of the family members, and enhance emotional security to others in the environment. And so these are the four types of suicide: egoistic suicide, and altruistic suicide, anomic suicide, fatalistic suicide. So egoistic suicide is, according to Durkheim, when a man becomes socially isolated or feels that he has no place in the society, he destroys himself. That is egoistic suicide. And the altruistic suicide is, so this type of suicide occurs when individuals and a group are too close and intimate. Anomic suicide, this type of suicide is due to certain breakdown of social equilibrium. And fatalistic suicide is a type of suicide is over regulation in the society. So under the over regulation of society, so people may commit suicide. So these are the four types of suicide. So then we'll discuss about risk factors. Male above 40 years of age, female above 55 years of age are the risky people. So men have greater risk of completed suicide. So and the suicide is 3 times more common in men than in women. Women have higher rate of attempt suicide. So these are the etiological factors: mental illness, physical illness, and psychosocial factors. In mental illness, major depression, schizophrenia, drug or alcohol abuse, and dementia, delirium, personality disorder. So these are the disease condition. People those who have this disease condition. So there is a chance to attempt suicide. And the physical illness such as patient with incurable or painful physical disorders such as cancer and AIDS. So there may be the chance these people they will attempt suicide. And psychosocial factors such as failure in examination and dowry harassment, marital problems, and loss of loved object or the person, and financial and occupational difficulties. So these are the things comes under psychosocial factors. So these are the three types of etiological factors. And what to look for, what we have to do when we found the the person is having suicidal ideation. So we should be very aware, be aware of certain signs which may indicate that the individual may commit suicide. Talking about suicide, so we should have keen observation. So if the patient is talking about suicide, we should be very careful and withdrawal from friends, family, and teammates. So some drastic difference we may observe when the patient or the person is having suicidal ideation, making statements about feelings hopeless, helpless, or worthless, and the drastic changes in mood, preoccupation with the death. So we can see if the patient is having suicidal ideation, so there will be a preoccupation about their death and purposelessness, no sense of reason for living, why I'm living. So no sense of reason for living. So those sort of sense will be the feelings will be there. A loss of interest in the things one cares about. So they will not give much interest, so which they have been given much interest before, and giving away valued possessions. So writing, making wills, and closing bank accounts, and giving away treasured articles. So those sort of behaviors we can observe. And unexplained anger, aggression, or irritability will be there. So so once we found this sort of these kind of behaviors in particular people, the person, the patient. So what we need to do is we need to monitor the patient safety needs. So in psychiatry hospital setup, what we can do is, and we need to immediately inform to the psychiatrist, and so do not leave the drug tray within reach of the patient, and we need to make sure that the daily medication is swallowed, and we need to remove all sharp instruments from the patient bedside. So we do not allow the patient to bolt his door on the inside. So and also we need to make sure that the somebody accompanies him to the bathroom. So and we need to have good vigilance, especially during morning hours, and spend time with the patient. We need to talk with the patient, and we need to allow the patient to ventilate his feelings, and we need to encourage the patient to talk about his suicidal plans or methods. So this will help us to plan some intervention to the patients. So how to start? So we knows that a patient is having, the person is having suicidal ideation, but sometimes we doesn't know how to start talking about the particular topic to the about suicide to the patient. So here these questions we can use when we become concerned to the patient. So we can ask these following questions we can use to start conversation. Do you feel like your mood has changed lately? Have you been feeling sad in the last week or two? Have you felt an increase in stress lately? Have any stressful events happened recently in your life? And have you had thoughts of hurting yourself? Have you felt so bad that you have had thoughts of death or thoughts of suicide? These questions we can ask. So, how to help the people? How we can help them? And if we have concern about the people, the person who is at risk to harm himself or herself or others, what we supposed to do is we need to ask them to talk with someone who can help, and we need to set up a meeting or a phone call with the mental health professional to assess safety. We need to stay with them until they are in the safe environment and have had contact with the mental health professional. We need to make sure that the follow-up appointment with the mental health counsel has been made. So if needed, if there is a necessity, we need to bring them to a local ER or hospital that can evaluate and offer a short-term stabilization for the patient. And I will be discussing about management of attempt suicide in the inpatient unit. So management of attempt suicide. So we need to assess for vitals and check airway. If necessary, we need to clear airway. If pulse is weak, start IV fluids, and we need to turn patient head and neck to one side to prevent regurgitation and swallowing of vomiters. And emergency measures to be instituted in case of self-inflicted injuries. So these are the management comes under attempt suicide in the inpatient unit. We'll see about management of shock. So management of shock, what we have to do is immediately we need to transfer the patient to medical center. So if there is no evidence of life, leave the body in the same position, a room in which it was found. In case the patient has attempted suicide by jumping, do not leave the body in a place which is visible to other patients of the ward. And we need to inform the authorities and need to record the incident accurately, contact local guardian and inform them, and hand over the patient properties to the patient relatives or the friends, and carry out the institutional formalities for the death certificate. So these are the components comes under management of shock. And so there are some myths and truths that we should know, that is important. And the myth is asking someone about suicide will increase the risk of suicide. No, definitely it is not like that. And it has been shown that asking someone about suicide lowers anxiety and opens up communication and lowers the risk. So which means we can very well ask someone about suicide. This will not increase the risk of suicide. This will reduce the lowest. This will reduce the risk of suicide, lowers the anxiety, and open up communication. So only expert can stop a suicide. No, not like that. Anyone can stop a suicide. What we supposed to do is we need to listen. We need to show our care to the patient or the person, or we need to provide hope. And the third one is suicidal people don't talk about it. That is myth. The truth is, most suicidal people have given some sort of clue or communicated an intent prior to their attempt. And then the next myth is those who talk about suicide don't do it. It's not like that. Truth is, those who talk about it may try and even complete a self destructive act. The next myth is once a person decides to attempt suicide, no one can change their mind. It's not like that. The truth is, suicide is a preventable form of death. Almost any positive action may save a life. No one can stop suicide. So the truth is, anyone can stop suicide if people is in get help from get the help they need. They are far less likely to attempt suicide. So these are the myths and the facts. So yeah, till we discussed about definition and the types of suicide and the risk factors, management of attempt suicide and management of shock and the myths and truths of suicide. So by concluding this topic, I would like to say, so what we supposed to do from our side when we found the patient or the person is having suicidal ideation. So we need to enhance self-esteem of the patient or the person by focusing on his strengths and rather than weakness. His positive qualities should be emphasized with a realistic price and the appreciation. This fosters a sense of self-worth and enables him to take control of his life situation. So hope you got little idea about suicide and prevention. Thank you.